How to diagnose COA. COA is usually found during childhood, and most of the time is found just minutes after birth during a physical examination. With today's technology, fetal echocardiograms are used to see if a baby has COA even before being born. As a matter of fact, me and my siblings had fetal echocardiograms done, knowing that my father's condition put us at a higher risk of having heart defects. If the patient grows older and the diagnosis hasn't been made, there are a few symptoms of COA that are noticeable, them being shortness of breath, pain in the lower legs, and colder extremities. Treating COA. Treatment depends on the severity of the blockage. There are two main treatments to COA, and they are open heart surgery and stent placement. Stenting is a less invasive technique, and can be used if the blockage can be opened from the inside out, and is usually performed on older children. In this picture right here, you can see the stent inside the blockage with the balloon around the outside of the wire mesh. And in the picture to the bottom right, the balloon is inflated, causing the wire mesh to open and for the blockage to be opened as well, allowing for normal blood flow to reach the rest of the body. After stenting, there is little or no recovery period, and the patient usually goes home the day of or the day after. If the stenting technique cannot be used, open heart surgery is usually the last resort. This is a very invasive surgery, meaning that large incisions have to be made to the body to reach the area. The incision is made from the back left shoulder blade, across the torso, and under the right pectoral muscle, or the left pectoral muscle. Once open, the doctor is able to see the aorta clearly and assess the constriction from there, then deciding on how to correct it. With this being an invasive surgery, a longer recovery period is needed. This recovery period is usually from 7 to 10 days. An outlook after treatment. After surgery or stenting has been done, future checkups are usually needed to make sure the patient is living a healthy life and the condition has been treated. Throughout his or her life, the condition will be watched very closely, and checkups will occur around every year. After treatment, these patients usually live a normal life and can do the normal things that any other children could do, such as sports and other physical activities. These are some of the interesting facts I found while researching this topic. Males are at twice the risk than females. This is a pretty outstanding fact. Another fact I found was that around 35% COA patients have a bicuspid aortic valve. This meaning that the valve from the left ventricle to the aorta only has 2 flaps instead of 3. These flaps keep the heart from backflowing and not pumping the correct amount of blood. The last fact I found was that COA occurs in 7% of congenital heart disease patients. My mentor for this year was Dr. Eric Eways. He is an interventional cardiologist at Cardiology Associates in Mobile. This meaning that he performs stenting procedures, pacemaker insertions, and even implants heart pumping devices. He is a doctor that enjoys company and teaches you everything that he does while job shadowing. This year I've really enjoyed spending time with him, and I learned a lot. A little bit about me. As I said, my name's Harrison. This is my 14th year at St. Luke's. It's a little weird because I have 20 days left here, but I am looking forward to continuing my education elsewhere. This is my 3rd year as a biomed student. I started the first year in biomed not really knowing what I wanted to focus on. But then in the second year of biomed, I shadowed a few cardiologists here in Mobile and learned that I really enjoy the field, and it would be a right fit for me. This fall, I plan on attending the University of Mississippi and majoring in biology. I feel like majoring in biology would lay a foundation of science that I would need in my future career endeavors. Thank you.
Good evening. My name is Jordan Lipscomb, and I am third year biomedical science student. A few things about me. I've been at St. Luke's for about 4 years. I've played sports basically all my life, 12 years. I have an aunt that has a doctorate in nursing, and I have a cousin that is an anesthesiologist. My mentor I chose for this year is David Bentley. David Bentley is a therapist at Fleming Rehab and Sports Medicine, and he's also a trainer at St. Luke's. I've met David my 9th grade year playing football, and believe it or not, I would come in every day during the football year, and basically come there and see what David's doing with the players, how he's stretching, how he's taping, just to get a better insight of what sports medicine or what athletic training is. So yes, what is sports medicine? Sports medicine is a field of medicine concerned with the prevention and treatment of injuries and disorders that are related to sports. And I have a few history about sports medicine as well. Sports medicine was discovered in ancient times. A man by the name of Herodotus, which is the father of medicine, he combined sports with medicine. He was a physician for Greeks during the Olympic times. He's the one that discovered that a healthy lifestyle and a good diet is key to having a good life. And Claudius Gallienus, he was a physician to gladiators in Rome. He would treat gladiators' wounds after battles, and he also discovered the skeleton outside his muscles along with it. All their works were pretty much vanished until the 20th century by the name of Archibald Vivian Hill. Archibald Vivian Hill was a physician. He won a Nobel Peace Prize in 1922 for the discovery of heat in a muscle. He also discovered the time of oxygen uptake during an exercise, and he also combined physics with biology, creating a field of biophysics. So who all here knows what a hip flexor strain is? Just by the raise of hands. What about a groin pull? Okay, well, those two things are pretty much the same thing. It is located in your inner thigh with your abductor and adductor muscles. This is an important muscle for many athletes, such as swimmers, football players, sprinters, soccer players. It allows you to pull your leg in, out, and side to side, and also up towards your chest. As you see right here, your abductor muscles, right here as well. There are a few preventions to this muscle. Stretching plays a key role in preventing this from happening to anyone. Also, appropriate training and a proper warm-up. With these 3 keys, you pretty much have a basic way of preventing this from happening. Many athletes get this due to poor warm-up and not very good training. The way to diagnose this injury is physician diagnosis is you will experience pain when lifting your knee towards your chest, stiffness after activities, swelling and bruising may be seen, and also physicians may use an X-ray, ultrasound, or MRI. There are also a few grades to this injury. A grade 1 is a mild discomfort, but it doesn't really stop your activity. A grade 2 is a moderate discomfort, which limits activity with walking, running, jumping, and also may see swelling. A grade 3, you will see the worst pain. Pain when walking, lots of swelling and bruising. The reason I chose this injury is during my football year, my senior year in football, I experienced this pain in my inner thigh. I didn't know what it was. I would go to David every day. We would go and stretch, do a few exercises, and then I would head to practice. But it got worse throughout the weeks until I woke up one Saturday morning. I couldn't really move my right leg. It was really stiff, lots of pain, swelling, and bruising. That's when I went to the orthopedic group, and they pretty much told me I had a pull groin strain. So I did therapy for about a few weeks, about 3 weeks, and I was back to my regular activity, but I still have to stretch it out because you still feel the pain while doing regular walking or running or exercises such as. There are a few treatment and rehabilitations for this injury. One treatment that is widely used in the therapy world is a TENS unit. The TENS unit is a transcutaneous electrical nerve stimulation. This sends electrical pulses through the skin to treat muscle spasm and strains. Also, stretching is not only prevent, but also treats this strain. And also chirotherapy or ice treatment, it decreases inflammation and also is a pain reliever. And also a heat treatment is used. This relaxes the whole muscle. It also calms the nervous system, reduces spasms, and increases blood flow to the affected area. Also, the ultrasound machine. I have an ultrasound machine up there near my presentation board. You might want to stop by and take a look at it. But this machine, it is used for a strain or pull muscle as well. It transmits heat through the skin, as well as it uses vibrations. It also reduces pain and reduces muscle spasms. Conclusion. For recap, stretching, it not only helps athletes, but common people as well. This injury can happen to basically anyone that does a lot of walking, sitting. For my road to my career, I will be playing on a team at the University of Alabama in May and during the summer, and I've already applied to their undergraduate athletic training program. I will receive a Bachelor of Science in the athletic training field, become a certified athletic trainer. I will also be getting a College of Environmental Sciences and Department of Health Science. Athletic trainers are health professionals who work and prevent, recognize, and manage and rehabilitate injuries from physical activities. Once I receive my degree in athletic training, I will then go to South Alabama and apply to their physician assistance program. Once then, I will pursue a career in sports medicine. What a PA is a physician assistant who practices medicine on a team along with surgeons and physicians. They examine patients, diagnose injuries, illnesses, and provide treatment. The physician assistance program is a 27-month program, and I received a degree in my Master of Health Science. I didn't choose to become a physician assistant until November of this year. It was when we, as a class, took a trip to the University of South Alabama and the allied health field, and then I discovered that the physician assistant program is right for me. Throughout my year of Biomed 1 through 3, I would go and discover research how I could become a therapist and help athletes, young NFL athletes, college athletes, any kind of athlete, because I had a sports background all my life, and I also had a family in medicine. But it wasn't until then I went to South Alabama and I discovered the physician assistance program, and this is what I knew what I wanted to become. So this is what I will be. Thank you.
What is the largest organ on the human body? I'll give you some